A common sports injury is a tear of the anterior cruciate ligament, or ACL. Once the tear is confirmed, the first step is called a notchplasty, where the femoral notch is widened, leaving enough room for the ACL graft. Subsequently, ACL tunnels are drilled through the tibia and then into the femur. The new graft will be placed through the tibia and then passed up through the femur bone. This is done arthroscopically, and here you can see a quadrupled hamstring graft being pulled into position through the anatomic tunnels in order to function as a new anterior cruciate ligament. After the graft is placed, it is tensioned and the knee is cycled through a full range of motion to make sure there is no pinching or impingement of the graft. Following that, the graft is tensioned and tied down over a fixation device on the tibia. There are many ways to fix the graft on the tibia as well as the femur. The graft is being tied, in this case, over a titanium post. Once the ligament is in position, tensioned, and tied down, the wound is then closed sterilely.